Hi everyone, my name is Dr. Kristen Wagner. I'm a local veterinarian here in Mount Carmel, Pennsylvania. I specialize in mobile end-of-life care, and I currently own and operate an ambulatory practice that sees canine and feline patients in home. I wanted to start sort of documenting my career a little bit more in kind of a different way. So here we are with the vlog or vlog. I don't know how to say it. I'm a millennial, but vlog. We're going to call it the vlog. And yeah, I'm going to upload these semi-regularly, kind of documenting different aspects of my life and my career. This is my 7th year as a veterinarian, and I'm going into my 2nd year as an end-of-life veterinary specialist. Maybe also taking on some videos out on the road, kind of showing you maybe like a day in the life or a day on call sort of thing. I don't know. I just thought it would be a very cool thing to share, since I just think this is the coolest branch of veterinary medicine. I myself have never felt so just fulfilled and inspired by a specialty before, as I do with the hospice and the end of life care. So yeah, that's the biggest reason for me that I wanted to start sharing my career a little bit more on a social platform, just strictly based on the magnitude to which it's inspired me. But also I wanted to document my patients as well. And it just so happens that timeline wise, I do have 2 older shepherds at home, so we're gonna kind of follow their end of life journey. I know it's very sad to say, sad to think about for me, but my clients go through this all the time. When they're making that final decision to say goodbye, I definitely want to focus one video on how do we make that decision to humanely euthanize? How do we know it's the right decision and the right timing? So yeah, lots of exciting things on the horizon. I am sitting on my living room floor for a reason. There's supposed to be a guest. Ma'am, you want to come over? An old lady guest. Takes her a while to get here. Come here, babe. Yes, we did practice. This is Una. Yes, baby. This is Una. You can't really see her too much. So she'll probably just lay down there. And that's okay. Oh, here she comes. Here she comes. So Una's going to be 11 on April 19th. Yes, you're such a good girl. She's been the sweetest, best girl for us. Oh, I know you're focusing the camera weird. Yeah. Una sustained a spinal injury in May of 23 that we honestly have kind of just been nursing her through, keeping her pain under control ever since then. And she went from day of the accident, complete paralysis of the hind legs. And my husband and I have just worked with her over the weeks and months, and she slowly healed enough to where she could stand on her own and even walk on her own again. So she just had paresis, or weakness, in those hind legs. And she was able to sustain like that for a long time. But the winter time, she's of course got other comorbidities, other diseases going on like osteoarthritis. So the winter time has been a great strain on her. And we've been seeing that it's definitely affecting her quality of life. So perfect kind of example to go through with you guys, something that I'm experiencing myself. And so when I'm looking at Una's quality of life, I basically, and if I were to come and do a consult on one of your pets, I'm going to ask you to kind of go back over the years and think about this particular patient and think about them at the best of their best. And of course we are a far cry from those days, right? But think of also where they were when we were just kind of maintaining, just kind of maintaining, and we're happy and we're doing our normal day-to-day things. And then we want to start to think about when those normal day-to-day things, even not even the best of the best things, but the normal day-to-day comforts start getting taken away as well. And then we have kind of dive into a deeper discussion on quality of life in that regard, right? Yeah, you're an expert. There are lots of tools and resources out there. I am just one of them. As a veterinarian who specializes in end-of-life care, I am just one of them that can help you to make that decision for your pet, whether or not it's time to humanely euthanize or consider other things that we would call comfort care, hospice care. So one of those resources that can help you determine your pet's quality of life is going to be your veterinarian or a veterinarian, specifically one like me who would specialize in end-of-life care. And my consult would take place in your own home, and we would basically go over in-depth your pet's medical history. A lot of owners already have their medical charts or copies of their medical charts ready for me to go through. We talk about the medications that they're on. And then it's so much cooler when I'm in their homes compared to in the hospital, because they can actually walk me through what a day in the life of their pet is. And in that way, I get to see sort of where are our main concerns. You know, is it walking out to the back stairs on the back decks? Those have been most problematic, and I can kind of try and troubleshoot those problems in doing things like adding sort of traction pads to those back steps and things like that. So that's just a small example of the benefits of me coming to your home to do this consultation, to really get in deep on the analysis of where is your pet's quality of life at today. So yeah, me coming into your home, I can certainly do a little bit more than what I otherwise would have been able to do in a hospital or a clinical setting. The pet's a lot calmer, and the pet is, you know, cats and dogs, they're both going to show me a little bit more of the truth of things when I'm doing their exam and looking for points of pain, and things like that. Yeah. See what we got. That's a little better. Bub, hey look. Hey look, Bub. We call her Bub. Her real name's Una. Okay, so if I come to your house, I'm likely going to be sitting on your floor, cat or dog situation. I'm likely going to be on the floor, so just don't be alarmed if that's where I'm comfortable, because that's where they're comfortable. And we just kind of get at, like I said, talking about your pet's medical history, and then we slowly will start to kind of allude into where they're at currently, where things stand currently with their physical state, and I'll start to do a physical exam, and then we'll kind of put it all together. And for putting it all together, there's a lot of resources on that as well. So I've got a couple here. This one here is a more of a survey style. It's called the Quality of Life Scale. It's very close to some of the surveys that you'll see. I believe Ohio State has something like this on their Preserving the Bond web pages, but this is, like I said, very much a survey style. Got a little drool spot on it, typical. That you would fill out on a regular basis, either once weekly or once monthly, or more often, once a day, if things are changing very fast, like some conditions can. So there's that. This one, now that one I don't know is for sure attached to my website. It will be soon. This one is for sure attached to my website, and it's just a little monthly diary calendar that is going to allow you to track good days versus bad days. And you want to put this in a very central location of the home so that everyone can look at it, everyone can take part in it as well. And the keys kind of up here, it says good day. You would mark off with a smiley face, and a bad day, a little X mark. And so you can use this for any month and go through and mark off X versus smiley face, good days versus bad days. And it's just a tool to help you see in real time, right in front of you on paper. We're having more bad days than good days, and it's time to call our veterinarian and have some discussions about that. Maybe recheck some things. So basically, that's kind of what I wanted to start out with for my first video today. Una, you did great. We're gonna practice on bringing Una in the shot. Look at her. Look at that. I mean, could you do better? I don't think so. You're amazing. You're natural. You're doing great. She's doing great. She's having some bad days, and I want to be very open and honest and almost kind of raw with this experience, so that other owners out there don't feel so alone when they go through their end of life journeys with their beloved companions, especially when my husband and I have had Una since she was 8 weeks old, so her pretty much whole entire life we have had and known her, and we have been through many adventures together, obviously a whole lifetime. 11 years is a whole lifetime of adventures and memories and lots of love. So over the coming weeks, I hope to be pretty open about her progression, things that I would be, sort of changing in her treatment style and why, and treatment options that I would use on her that could be applicable to potentially use on your pet as well. So if you had questions on anything that I would mention, then you would just go ahead and reach out for me. We can either to sort of schedule a consultation, or reach out with a question. I can make another video about that and so on. So yeah, that's me, that's us. And hopefully this will get better as it goes along, and I'm not such a hot mess express on camera. Una's already got it down. So, right? Right. Yeah, you're giving me that look like, yeah, right. Okay. Oh no, she's hitting me. Say bye. Say thank you for watching. Thank you. I love you. Yes, thank you very much. Oh, you're a good doggy. Yeah, you're a good doggy. Yeah, we're going to share your story because you're a good doggy. Okay. All right. Gotta go. Bye.